All right, guys, we're live.
No.
Oh, I was like, what? Hey guys, it's Dr. Emer. We're here in New York. Look, we're right off Central Park. Take a
Right
look.
here, guys.
Beautiful view in Manhattan, Central Park South, with one of our favorite clients who's done a few laser treatments before. And Jordan will show you her before and after. She had some damage to the skin. She has some bad ice pick scars and textural irregularities that have improved with a few laser combinations. Today we're going to do a laser along with some filler. We're going to use Bellafill to fill some scars. She actually probably won't need any more than this based on the scars that I see. I want to show you guys though, when you look up close, she has some stubborn ones like this, for example, this bigger one right here. Sometimes these are going to be easier to literally just punch out. So my suggestion will be when we do our next bigger laser, let's say before summer or something, just punch out a few of those and we'll basically get to the point where we're probably just in maintenance at that point. If we look over here on her left side, she had some really severe scarring. It's improved a lot. So I'm going to use Bellafill into some of these scars here.
The before right now.
We're going to show you the before. Hold on. Jordan's about to pull that up.
There
There's the before. Now let me turn you just a little bit so I can compare slightly. So if we zoom in a little bit closer, Jordan, can you go? What? So if you zoom in right there, there's the after a few treatments.
She's a little red from numbing.
So now I'm going to work to kind of fill some of these little baby scars in. Jordan can show you again the results. So the goal will be energy-based treatments long term.
And we're back.
And wait, hold on. Need another needle. This one's too dull.
Guys, let me show you her before and after, guys. We're really happy to show her this. Here's her transition, actually, guys. That bloody picture is the immediate after. Then she was still healing there from the TCA, and this is today.
Let me see.
Oh,
you're showing it now?
I'll show them right here.
So, oh yeah, I mean, so if you take a look here, you guys, from where it was before, that's very significant. So that makes me happy. We can get to perfection. It's just going to take us many treatments. So we have to be okay with that, the movement of that. So what I'm trying to do is under some of these scars.
How great she looks in her results. They're very happy for her.
And you guys, you won't even believe this. We did a random giveaway. When was that? When was the giveaway? That was when
we had a big giveaway. It was early
New Year's?
It was around Christmas, wasn't it?
Christmas?
Yeah.
And she won.
Oh.
Our own client won. There was thousands of people, and it wasn't it the spin the wheel thing?
It was the spin the wheel.
And it was a random spin the wheel, and she won. So she's using Emerage skin and nude skin.
She had a lot of aftercare for her treatment.
Yeah. So our goal is to just keep building. So for those that are Bellafill providers, you're not going to see this technique frequently. I call this a scaffolding technique. We go through some of the scars and use the needle as a subcision.
People want to know, does it hurt?
The Bellafill?
Yes.
Just a little bit. You'll be fine.
She's very strong.
People are saying they love your voice.
Aww.
They're super excited today. All right, I'm going to switch her hold right here. Yep. So we're doing this little technique. It's almost like a needle subcision. And then we're going to follow treatment with, we're going to use original, right? Yeah. Perfect. So make sure you have the original.
We'll probably jump into that now.
You can. Switch.
Guys, our rooms are a little bit smaller here, but
Yeah.
we have New York view. We have the New York view.
Turn this way.
small in here.
But we got the view, I know. We've got to be close, happy and close. It's like a family in here. So the other thing too, when you have these bound down scars, you have more scar tissue. So we're going to use the filler very superficially. You see this? Like the almost
saying Bellafill is bad.
Bellafill is bad. I'm using Bellafill for, she said you're bad. Bellafill is a permanent filler. It's the only one FDA approved for acne scars, actually. And just so you guys know, in small quantities, even silicone can be safe. There's lots of studies on it. You see I'm breaking this tissue. I'm sorry, it might hurt a little bit. I'm trying to break the scar tissue right here. There we go. So we cut through the scar tissue, the tethered bands, almost like a subcision. Just do a little bit of the filler. So let me get another needle. So basically Bellafill is collagen with PMMA. It's okay. PMMA is polymethyl methacrylate. It is an acrylic polymer, so you want to use small quantities. It's not bad, it's just a different material than you're used to. So when you use it, and she has it, it's safe.
And what does it call when you big quantities in the body?
Bella lift. What do you do for the buttock or the hips? We get a little Bella lift. Yeah, but for scars, you need small quantities. You do micro droplets. So we do little bits, and you guys can see we're using only about 0.8 cc's of the Bellafill. With her, I got to do a little scaffolding. I'll go through. She's got deeper scars here, so. But a lot of these scars now are more superficial. So we're really, sorry, honey. The majority of what we're trying to do is lifting.
Go live with Silpharm X, please. They might have known what we were doing before.
Ooh, that's coming soon, guys. Coming soon. A bunch of Silpharm for you. Okay, perfect. All right, so we're done with the Bellafill. Actually, hold on, I have a little teeny bit. Let me use this one, the last one over here. I'll switch it and we'll lay her back. So go ahead and turn. There we go. So you can see now when I pinch, you see how the scars are, they're not indented. So basically it's all textural now. So all we really need to do, although I'm gonna give her a little volume, a little bit for lifting this area right there. This is more textural now. So we're gonna lay her back. We're gonna start laser. I'll hold. We're gonna laser her. Now we're doing a lighter treatment and maintenance plan. We're gonna use Clear and Brilliant 1440. Long term, we're gonna do another bigger treatment. I really feel she's only gonna need probably one of those and then maybe a punch excision or two to these spots. We could even do a little more TCA if we wanted.
We have the people that are treating this as a dating app too.
What'd you say?
Saying, I can't wait to come see you, Dr. Emer. Don't need treatment, but I want to see you.
Oh, thank you. All right, well, you can come see me. Feel free to send your resume and pictures on our Instagram. I'm currently single.
Oh my gosh.
Ready to mingle.
Ready to mingle, as Rosa said. We're in New York, right? No, I'm kidding. I'm kidding. Okay, so now we're going to start our laser.
Does Bellafill have any chance of migrating?
Really, any filler. Do we have a tip?
And
Any filler has the ability.
Form lumps.
Yes, any filler has the ability to lump or move, you guys. However, when it's injected in a microdroplet technique, the chance is much less. I'm going to need my little bubble goggles. Do we have them? She's fine. So we're going to use Clear and Brilliant Original, and then we're going to do some microneedling. I'm going to be really aggressive with the microneedling on the cheek area. So you guys normally see the blue hand piece, that's Permea. But we're working on scars, so we're gonna go a little bit deeper. So she's gonna feel it, but not too terrible. This is a low density, low level laser. For those that have never seen this before, this is often used, what were you saying?
People are asking, what did we do to her face, guys? Let's show them the results of our last couple treatments we did, guys. Here's her before and after, guys. She saw a tremendous improvement. Those scars, guys, look so much better.
Tell them some of the treatments we did, Jordan, to get to that.
We've done our Halo laser from Cyton. We've done our CO2.
Can you also
guys, we've done
give her the fan?
microneedling for her as well. We've done our chemical peels. We've done at-home treatment with skincare. Lots of stuff for her.
So some of these scars are really difficult, like these bigger, deeper scars here. We use the Bellafill on.
People writing in, guys, have more questions coming for you. Do you guys do any treatments for hyperpigmentation in the butt area and butt cheeks?
Yes, very much. Now, if it's in the crack, it's going to be a little different than if it's on the butt itself. So you guys need to tell them, Jordan, how to do a virtual consult for skincare.
Guys, you need a virtual consult for skincare, guys.
Okay?
You can go to emeragecosmetics.com, get a skincare consult on there. Or you guys can send us a DM, email with your full name, email, and phone number, and our team's going to reach out to you.
So normally Clear and Brilliant, you guys, is painless, but Original is a little deeper. So she's feeling it a little bit, even with the topical numbing. It's still minimal pain, but it's more pain than you would think as a light laser because it's low density, but the energy does go pretty deep. So how would you say this is compared to the other treatments? Although you had nerve blocks.
Yeah, but the other ones were still
painful.
Crazy, yeah.
Yeah, which one was craziest? The CO2?
I don't remember the name. The craziest one.
CO2. Yeah, that's the CO2. How was the healing though? Was the healing painful, or just the treatment?
No, the healing's not painful. Just the day after, you're numb and swollen.
Got it.
You'll be fine.
Got it.
This is our lower downtime laser. It's not anything super brave, not high downtime, guys. It's safe for all skin types. We use it all the time in our office. It's a really quick treatment that we like. People can come in LA and they do it on their lunch breaks.
Yeah, people call this a lunchtime,
laser in LA.
Although I don't know if it really is because you do get swollen from it, but you can do this quickly. And it is a maintenance treatment, so I just did another in another room from a patient of mine. I also had acne scars for many years. Pretty much all the scars are gone now. She just maintains by doing Clear and Brilliant as her regular sort of anti-aging treatment. And in this case, she's obviously very young. She doesn't even need anti-aging. She does prejuvenation is what I call it. Before you even need to rejuvenate, we're prejuvenating. But this is for her scars. So we want to do something for her that's going to get her scars improved without having a ton of downtime. This is a good treatment. Now, Pixel or Morpheus or Fractora, any of the microneedling radio frequencies, those can actually do really well too. But in this case, they don't improve the scars that much because these are these more ice pick, thicker scars. They tend to not be as good for that. Look up close. Can you guys see the little dots?
I was asking which one is this? They're asking about our laser.
This is the original Clear and Brilliant. She's doing really good. I know she's feeling it. So once you get to about 50%, you feel it. Has anyone said anything to you about your skin? Like any of your friends or family? Have they mentioned anything to you? Anyone that doesn't know? Do they think you look really good?
Well, if they don't know, they're just like, oh, you have really good skin. You know, actually, when I did the bigger laser, when was that? Like 2 months ago?
That was 2 or 3 months ago, yeah.
Last time we were here.
Yeah, so I was still red at work, and they were like, what the hell did you do? And I was like, what do you mean?
Yeah, you
like,
stay red for a while.
You should do this too, because they're trying to make me feel bad. Like,
but did they think you looked good, or they were just curious? What was it?
They're just nosy. But
They
then
were nosy.
afterwards, you know,
nosies. You guys are too nosy.
Then afterwards, they were like, oh my god, that laser thing you did, your skin is
Looks
glowing.
so good,
you look so good. I'm like, yeah, you should do it too.
Little did they know that she's not going to age anymore, and they're going to continue to age. Exactly.
Yeah, they're like, you're so red. What did you do?
Well, that's the thing. So the thing about laser, you guys, especially CO2, and a lot of my clients that aren't prepared, you can actually be red for 3 to 6 months. Now, I tell people the downtime is 1 or 2 weeks. That's true for the scabbing. But you can have redness and sensitivity for many, many months afterwards. Sorry, honey.
People are saying their patients can't usually tolerate the pain of this. How can they manage it?
Come to us.
Just
And
close
you got
your eyes.
Rosa. Look at Rosa.
We got Rosa over
She's here. Rosa gives a wonderful massage.
That's how we manage.
It's included in the price. And she does shoulder massaging. So that's important.
Only.
Talk aesthesia and shoulders. Yes, exactly. Don't think anything else, you guys. Exactly.
They're gonna come and be like, she said.
I know. Exactly. We're almost done. We're almost there. I'm just trying to get a good amount over her main scarring area. If you guys listen, you can come really close. You can actually hear it. It almost has a scraping noise. That scraping noise are the non-ablative wavelengths going into skin. This is a diode laser, so you can't actually physically see light because it's penetrating the skin in a different wavelength that your eyes can see. All right, last pass. So now if we take a look, I know she's got pain because you see the yellowing to the skin. Do you guys know what that means? Swelling. That's swelling. So you see that yellowing? That's right where we want. That's the perfect. All right, last passes, okay? I'm getting there. She's doing really good. I want her to see results. I want her to stay looking good. I want her friends to be jealous at work. So that's the key. But they are going to ask you why you're red in the next day or two, probably. No, actually, you'll probably be fine by the time you go back. But this shrinks pores. I think one of the #1 things that people say about Clear and Brilliant, you guys, pore reduction. And if you look at the clinical trials on Clear and Brilliant that were performed years ago, Vic Narcar and some other, that's pretty dramatic for a laser. All right, final. Saying. Okay, so now let's do the microneedling. All right, last part. I'm gonna take these off. We're gonna put a little
Back
bit
in
of
the
gel.
light.
Perfect. What?
So back into the light.
So I'm gonna put some hyaluronic on here. This is our Hyla B. We always use this afterwards. Our hyaluronic acid, Emerage Skin. You guys can Emerage
That to heal
Cosmetics.
before when she her first treatment. We have videos of her. She was using.
She was, yeah, we have some great videos of that. She made amazing home videos of using skincare. I'm gonna get her really moist, you guys. Really moist.
Guys, we're doing a combination.
Sorry, it's gonna
treatment
feel really
today
wet. Okay.
for our patient's acne scars.
Now.
We did some bigger laser treatments before for her. We'll show you those results after the live. We're gonna post those to our feed. Earlier in our treatment today, we did some Bellafill to add volume to the scars. Our clear and brilliant, and now we're doing some microneedling.
This hurts a little bit, you guys. I'll tell you why. We're going a little deeper, and I'm gonna do a different technique here. This is a stamping technique. We're gonna do this over the deep scars so she can get real bloody. She's done this before. She doesn't like it. No one does.
She likes the results.
Everyone likes the results. Again,
someone has acne areas around her lip and chin, guys. Send us a DM. Full name, email, phone number will help you out.
Let's get you through it. Let's get you through it. Just think of how young you're gonna look when you're 50. Okay.
Cycon Josh said happy Friday.
Hey,
Josh. An amazing New York weekend.
Can't wait to see you. Expect a lot of food. A lot of ordering.
You're gonna be hungry. It's been a busy day.
That's 8 halos.
Who's Josh?
Josh is one of the representatives for Saiton that makes Halo.
The one we did on
so you should tell him
we'll show them the result
that you love him because you did a Halo before.
Josh, I love you.
She loves you. Josh, you know what that means. You got to give her a free Halo treatment.
Yes, call me.
Call her.
Alright, guys, here's the results. If you guys want to
Alright, last one on the forehead, okay? Bear with me. Bear with me. Deep breath, deep breath, deep breath. You can get through it. Get through it. Get through it. We're using the Eclipse 10 Evo. Oh, okay, good. Alright, now back on the cheek. Hold on. So again, trying to get a little bit more of the cheek. I'm going to use a little bit of a stamping technique. I'm going a little deeper. Going a little deeper here. Alright, last one, okay? Ready? Nose, just a little on the nose. A little on the nose. Let's get the cord. Your cute little nose. All right. Done. All right, hold on. All right, perfect. So that's the deeper microneedling. It's more painful, you guys. We want to keep the blood on the skin. We don't want to get rid of it. So we're going to press that on there. And then we'll apply some Emerage Skin products to her skin and we'll be good to go. So that's our combination of using Bellafill for deep scars, laser and microneedling for maintenance of acne scars. Stay tuned, Josh. Make sure you call her. She wants a free Halo. Okay?
Call me, Josh.
All right, perfect.
Oh my God, I'm
All right,
alive.
You did good.